Good morning, I'm Dr. Lau, the ophthalmologist. I understand you've been referred here because of concerns about your vision. Could you tell me more about what you're experiencing?
早晨，醫生。最近6個月我嘅視力變得好模糊，特別係當我嘗試睇書或者望啲細節時，我感覺最明顯。
Blurry vision is a common complaint in patients with cataracts. Do you also have difficulty seeing at night or in dim lighting?
有，特別係我揸車嘅時候，對面車嘅頭燈好刺眼，我仲見到燈周圍有光暈。
That's a classic symptom. Halos and glare are caused by the scattering of light as it passes through a cloudy lens. Have you had any double vision or changes in your color perception?
有時我望嘢嘅時候會見到重影，顏色都睇落冇咁鮮豔，好似一切都冇咁鮮明。
These symptoms strongly suggest cataracts, which occur when the natural crystalline lens in your eye becomes opaque. This opacity interferes with the passage of light to the retina, affecting your vision. Can you tell me if anyone in your family has been diagnosed with cataracts? It can sometimes have a genetic component.
我媽雙眼都有白內障，不過佢直至70幾歲先做咗手術。
Understood. Aside from your family history, there are other risk factors. Do you have diabetes, a history of prolonged steroid use, or have you been exposed to UV light without proper eye protection?
我有糖尿病，不過用藥控制得好好。我都用咗幾年吸入型類固醇治療哮喘。
Both diabetes and chronic steroid use can accelerate the formation of cataracts. Diabetes can lead to metabolic changes that affect the lens, while steroids increase the risk of posterior subcapsular cataracts, which develop at the back of the lens.
明白。
Let's conduct a thorough eye examination. We'll start with a visual acuity test to measure how well you can see at different distances. Then, I'll perform a slit lamp examination to get a magnified view of your eye structures. Finally, I'll dilate your pupils for a detailed look at your lens and retina.
冇問題。擴瞳會唔會令到我唔舒服？
You may feel mild stinging when the drops are applied, and your vision will be blurry for a few hours. It's best to avoid driving afterward.
我自己揸車嚟，點算啊？
You can wear sunglasses to reduce sensitivity to light, but I still advise against driving immediately after the dilation. Your vision might still be too blurry to drive safely, especially in bright sunlight or low light conditions. It's better to call someone to pick you up if possible or use a rideshare service. Safety is the priority.
好煩，可唔可以唔做擴瞳？
I understand it's inconvenient, but dilating the pupils is essential for a thorough examination. It allows me to see the back of your eye, including the lens, retina, and optic nerve, which is critical for diagnosing cataracts and other conditions like diabetic retinopathy. Without it, I might miss something important.
我明白，冇得揀。
I appreciate your understanding. Let's get started. Please look up at the ceiling and try to keep your eyes open. You might feel a slight sting when I apply the drops. Are you ready?
準備好。
The results confirm that you have bilateral cataracts, with the left eye being more severely affected. I also noticed some early signs of diabetic retinopathy, which we'll monitor closely. The left eye has a denser opacity, which explains why your vision is worse on that side.
有啲咩治療方法？
The primary treatment for cataracts is surgery, which involves removing the cloudy natural lens and replacing it with a clear artificial intraocular lens. This is currently the only way to effectively restore vision.
唔做手術可唔可以醫治？
In the early stages, we can manage mild cataracts with stronger prescription glasses, anti-glare coatings, or brighter lighting. However, when the cataract progresses to the point of interfering with daily activities, surgery is the only effective treatment.
手術係點做？
Cataract surgery is a procedure where we remove the cloudy natural lens and replace it with a clear artificial intraocular lens. We use techniques like phacoemulsification, where ultrasound waves break up the cataract before removal.
咩係人工眼內晶狀體？
An intraocular lens is an implant that replaces your natural lens. We offer different types of IOLs, including monofocal, multifocal, and toric lenses. Monofocal lenses correct vision at a single distance, while multifocal lenses provide both near and far vision correction. Toric lenses are designed for patients with astigmatism.
我點樣知道邊種晶片最啱我？
We'll discuss your lifestyle and vision needs to make a recommendation. For example, if you read a lot or work on a computer, multifocal lenses might be suitable. If you have astigmatism, a toric lens could provide better clarity.
有冇風險？手術安唔安全？
Cataract surgery is one of the safest and most common surgeries worldwide, with a success rate exceeding 95%. However, as with any surgery, there are potential complications, such as infection, corneal swelling, posterior capsule opacification, or even retinal detachment. These risks are rare but important to understand.
如果我唔做手術會點？
Without surgery, the cataracts will continue to worsen, leading to severe vision impairment. In advanced cases, the cataract can harden, making surgery more complex. It can also increase the risk of secondary glaucoma.
咩係次發性青光眼？
Secondary glaucoma occurs when an underlying condition, like a cataract, disrupts the normal drainage of aqueous humor in your eye. The aqueous humor is the fluid that circulates in the anterior chamber of the eye. If the lens becomes too thick, it can block the drainage of fluid in your eye, leading to increased intraocular pressure. This is known as secondary angle closure glaucoma and requires immediate treatment.
我可以幾快做手術？
We can schedule it within the next 2 to 3 weeks. Before surgery, we'll measure your eye's axial length and corneal curvature to determine the appropriate IOL power. You'll also receive preoperative instructions, including stopping certain medications that increase bleeding risk and using antibiotic eye drops.
康復需要幾耐？
Most patients resume normal activities within a few days, but full recovery takes about 4 to 6 weeks. You'll need to avoid heavy lifting, bending over, or rubbing your eyes during this time.
手術之後會發生啲咩事？
You'll need to use antibiotic and anti-inflammatory eye drops for about 4 weeks to prevent infection and reduce swelling.
手術後我會唔會好痛？
Most patients report only mild discomfort, such as dryness or a gritty sensation in the eye. We'll provide lubricating eye drops to help with this.
瞓覺呢？
We'll give you a protective eye shield to wear at night for the first week to prevent accidental rubbing while you sleep.
我幾時可以再睇得清楚？
That depends on the type of IOL we use. Monofocal lenses typically correct vision at a single distance, so you may still need glasses for reading or close work. Multifocal or accommodative lenses can reduce the need for glasses at multiple distances, but they're not suitable for everyone.
有冇啲併發症我需要留意？
Serious complications are rare, but they include infection, inflammation, retinal detachment, or corneal swelling. You may also develop posterior capsule opacification, or secondary cataract, which can be treated with a quick laser procedure called YAG capsulotomy.
如果手術後我發現有啲問題，我應該點做？
Contact us immediately if you experience severe pain, sudden vision loss, flashes of light, or a significant increase in floaters. These could be signs of a serious complication, such as retinal detachment.
我需唔需要復診？
Yes, you'll need to come in for a post-operative checkup the day after surgery, then 1 week later, and again after 1 month. These visits are crucial to monitor your healing and ensure there are no complications.
我可唔可以喺手術後繼續食我平時食嘅藥？
Some medications, like blood thinners, may need to be paused before and after surgery to reduce the risk of bleeding. We'll discuss this in detail during your preoperative consultation.
太多資訊，我會唔會有書面指示？
Yes, we'll provide a comprehensive guide with all the pre- and post-operative care instructions. You'll also have our contact information for any urgent questions.
多謝你解釋得好詳細。
You're welcome. I'll have my assistant schedule the surgery and provide you with a detailed handout on cataract surgery and recovery. Remember to call us if you have any questions before or after the procedure.
多謝劉醫生。